You've been given a script for Zyprexa, but you're too afraid to get started on it because you feel like your provider didn't give you any education about what to expect. Well, today, I'm going to review 5 must-know facts about this medication so that you can be better informed when deciding whether or not to try it. So the first thing to know is that this medication goes by 2 different names. Zyprexa is the brand name and olanzapine is the generic. So don't be confused if you hear your provider refer to it by more than one name. Fact number 1 to know about is how this medication works. So Zyprexa is considered to be an atypical or second-generation antipsychotic, and it's thought to mainly affect the neurotransmitters serotonin and dopamine. And these can lead to the reduction of things like positive or negative symptoms of schizophrenia. It could stabilize mood, or it could lead to improvements in things such as aggression or agitation. This medication is approved for the treatment of schizophrenia and bipolar disorder in those 13 and older. And then for bipolar disorder in particular, it's specifically used to treat mixed or manic episodes in addition to being used for maintenance treatment. And then the intramuscular form can be used for acute agitation that's seen with schizophrenia or bipolar mania. And then Zyprexa is pretty unique in that it has a formulation where it's a mix of olanzapine and fluoxetine, which is Prozac. And this formulation is used to treat bipolar depression in addition to treatment-resistant depression. So as you can see, there's a whole range of uses that it's actually approved for. And then there's off-label uses as well, which could include things such as other psychotic disorders, behavioral disturbances, anxiety, disorders associated with impulse control, and borderline personality disorder. Fact number 3 that I want you to know about is how Zyprexa is prescribed. Now, this medication comes in many different forms, and this is something that makes it somewhat unique compared to the other atypical antipsychotics out there. There's tablets, orally disintegrating tablets, intramuscular injections, depot injections, and a combination capsule of olanzapine plus fluoxetine. So it's really versatile. So the main thing that I'm going to fill you in on today is how the tablets are prescribed, since this is what we see most in the outpatient setting. The typical dose range is somewhere between 10 to 20 milligrams per day. Most people will start on 5 milligrams daily and then gradually increase the dose in 5 milligram increments until the target dose is reached. And the max dose is 20 milligrams per day. However, I have seen some prescribers go as high as 30 to 50 milligrams per day in those who are really treatment resistant. Now, one of the main questions that I'm asked is how long does it take for this medication to start working? And this depends. So if someone is taking it because they're manic or psychotic, you'll generally see symptoms start to improve within the first week or so. However, it can take several weeks for it to take an effect. Literature generally states that one should wait 4 to 6 weeks to determine efficacy of the drug, but some patients have required even longer than that, especially when we're talking about improving those cognitive symptoms. And now for fact number 4 to know about, the side effects of Zyprexa. The top ones reported by the FDA include lack of energy, dry mouth, increased appetite, sleepiness, tremor, constipation, dizziness, changes in behavior, and restlessness. Now, just like with every other medication out there, there are a ton of other side effects that we could talk about that are pretty uncommon and would take up a whole lot of time. But if you're gonna leave this video with anything, I need you to know that Zyprexa is one of the worst offenders out there of any psychiatric medication for causing weight gain and metabolic side effects. The FDA label itself states physicians should consider the risks and benefits when prescribing olanzapine to patients with an established diagnosis of diabetes mellitus or having borderline increased blood glucose levels. The reason behind this is that this medication has been associated with things such as hyperglycemia, dyslipidemia, and weight gain. These changes then can increase your risk for cerebrovascular and cardiovascular events. So let's break this down a little further and look at each of these factors individually. When we're talking about glucose levels, researchers found that those who were on olanzapine for an average of 9 months had a mean serum glucose increase of 15, with lipid levels, triglycerides increased by 40.5 and total cholesterol went up by 9.4. Now let's really focus in on the weight gain with this medication. After 6 weeks of treatment, right? Just 6 weeks, the average person will gain around 5.7 pounds. And when looking at long-term studies, what we see is that the percentages of people who gain at least, 7, 15, or 25% of their baseline body weight were 64%, 32%, and 12% respectively. So it's not unexpected for someone to come to the office after starting this medication, and you'll see that they've had like a 30-pound plus weight gain, and it truly can be life-altering for some people on this medication. Something else to know about is that Zyprexa has a black box warning. It states that elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. Studies show that the incidence of death in olanzapine-treated patients was 3.5%, which is significantly higher than the 1.5% of those who were treated with placebo. Fatalities were mainly from cerebrovascular events, so we're talking about strokes and TIAs. Fact number 5 to be aware of is how to stop this medication. When deciding to come off of Zyprexa, please do not stop taking this medication without talking to your physician first, because they can help work with you to come up with a plan on how to stop the medication so that unwanted symptoms don't occur. Some people will experience involuntary movements, and these are called withdrawal dyskinesias, and this happens typically within the first few weeks of lowering the dose or stopping the medication. These typically go away, but I've seen them persist for a couple of months in some patients following discontinuation of treatment. In addition, rapid discontinuation can lead to rebound psychosis or mania, an overall worsening of symptoms. So we really want you to work with your physician when coming off of this medication. The big takeaway is that this medication is not one to mess around with. There's a lot of off-label use when it comes to psychiatric medications, but I'd really consider using this medication appropriately and for the shortest duration as possible. Now, click on that top video if you want to learn more about another commonly prescribed atypical antipsychotic.